Laura Budan este numele meu. Suntem încântați să vă primim în noastră locație. Bine ați venit! Îl prezentăm pe partenerul nostru, care este de la Creation Medical. Ei sunt producători de aparate electromedicale, proiectează și produc aceste aparate la solicitarea medicilor, nu la solicitarea pieței. Împreună ne axăm pe formațiuni, pentru a face cunoscute aparatele și mai apoi pentru a cumpăra produsul dacă considerați că este pe placul dumneavoastră, ca să putem să-l exploatăm la maxim după ce îl cumpărăm. În același timp o să aveți și un helpdesk prin canalul de WhatsApp pentru orice solicitări ulterioare de care veți avea nevoie. Davide?
Thank you for presentation. Okay, this is types of the courses. So the courses have name educational. The concept of the divulgation of technology. In this case, the laser. Okay, technology, the laser in use in odontologic and dentistry, and few information and the final the course. They use this technology for aesthetics medicine and physiotherapy. Okay, and the types of the courses. Okay, let's introduce myself. My name is David Bosco Lantoliti. This is my reference. If you want, send me the mail after the courses for answer the questions. Okay, for the WhatsApp, I send you respond. I have been scientific disseminator about 26, 27 years. I collaboration with 767 university in Italy in the world for the courses. I research and traduce the research in didactical for the courses. I the tutor in the university for the use of laser into the pattern. I honoraris member the SNOI, Society National Odontologic Italian, and CD, Society Hygienist in Italy, because the hygienist in Italy in this year is the most important figure, professional figure, album, professional album. Okay, I am manager of Creation Academy. The Creation Academy is a platform network with about 5,000 dentistry that collaborate in this academy. Okay. The courses have packet courses, including the book. The book translated in Romania. Okay. This is inside in the bag of the laser if you want and interest the laser or the courses pack. Okay. Another types of the courses, educational deals, scholarization after the by the laser. About 3 or 4 hours, specifically for single types of the protocol for the use of the machine, okay? And DIP 1 and DIP 2 in this moment in Italy and in English, okay? This is course in depth for the single family of the protocols. The protocols about 80 number, okay? And subdivided in 7 or 8 family. For you remember a single types of the family, we make the in-depth about online every 2 months, one different family of the protocols. Educational about educational about 2245 number of slide. 570 slides for scholarization in different types of the courses. Another service at desk telephonics. You send the message, I respond to the problem. Okay. This is an example. Last week at Palermo, Italia. This is types of the courses the scolarization, I the tutor for the user. I don't touch the pattern because it's not possible for me, but I the tutor. Okay. The sponsor creation, it's March of NB Electronics. The companies produce the medical device and the electronic system, for example, Epson, Enel, the big names. It produce electronics and have the asset, the name creation, only medical device. The design and produce totally only made in Italy. We produce 4 types of the laser, one intraoral welder, electroporation for aesthetics medicine, one device for surgical extract. Okay, another two machine, micromotor piezo surgery. This is in combination with Korea Society. Korea Society produce mechanical, we produce electronical. This I speak later. But every you buy the machine have the marketing pack. But see later. Okay. Okay. Familiar with the laser. What is the laser? The light amplification, stimulation, emission, radiation. They produce the photon. What is the photon? The photon is a packet of energy. Okay, don't have the mass, but behave like mass when encoded of a speckle and generation of the heat. Okay. What's wave interest for a dentistry? 810 nanometer and 635 nanometer. This is important, this number, for types of the light for the using in dentistry, for have the goal. We see about 400 nanometers and 700 nanometer inside the rainbow, between UV ray after the infrared ray. We speak the 635 nanometer, the types of the red. Because what types of the red? I use every types, no, these types, because if these types are particularly specificity produce the prolina, substrate of fibroblast, produce the 5-3 of collagen. Okay, so much important for biostimulation. And 810 nanometer in this position, infrared, non-visible for human, for the action to the mitochondria, melanina, hemoglobin. The difference between the home light and laser, the home light have a divergent, multicolor, no coherently light. The laser is colimate, monochrome, and coherent. Every photon go together, okay, in the space. Some tissue absorb light only at specific wavelength. Don't have the wavelength. When you see laser, no specific type of laser, don't have a specificity. We interested the hemoglobin and melanina because this is an endogenous chromopher. When this is not present, and use the exogenous chromopher. For example, povidone iode, methylene blue, toluidine blue. Attention, when you have the subject with glucose 6-phosphate deficient, don't use methylene blue, only betadine. Okay. I don't like hydrogen peroxide. If you go to the university, the courses, or read the book, you use the hydrogen peroxide. But the recent paper, scientific paper, don't use these types of the products inside the pocket because property cytotoxics is not good for cicatrization, for the times of the cicatrization. The citus react to the laser absorption, transmission, scattering, divulgation inside the tissue. And reflection. For reflection, it's so much important the safety, the glasses. Okay. This is most important, the 5 biological effect of 810 nanometer: anti-inflammatory, physiological analgesia, hemostasis, decontamination, and biostimulation. For me, the most important is biostimulation, because never in the odontoiatric studio possible make biostimulation. Okay. Anti-inflammatory, because the action, the laser with the tissue, stimulation the prostaglandins, cytokine, and interleukin. Physiological analgesia, thank you to polarization RNA, not the RNA, in the melanin transmission, okay, in the Schwann guina, and reaction with the polarization reduce the nociceptor. Hemostasis, thank you to interaction the laser with the iron inside the hemoglobin and block the bleeding. The decontamination, it's possible have 2 effects. One, thermical or physical effect, because over the 50 grades, blocking the macromolecules, okay? And chemical and physical, because the 810 nanometer activate the photosynthesis that produce the single oxygen, causing the degradation of the organic materials. For example, methylene blue or protoporphyrin. Biostimulation, when I use 635 nanometer, which acts to prolina, okay, substrate of the fibroblast. And when you use 810 nanometer, stimulation mitochondria. Inside mitochondria, produce the ATP, adenosine free phosphate. Okay. By stimulation possibility in the reproduction of the cellular tissue translates into a change of the aldering times. For example, if on every day, and the operation uses the cold blade scalpel, okay, yields in 10 or 12 days. With you, the laser, the same result in 6 or 8 days. Okay, what's the motivation for the choice the laser? Not the mark, but the technical choice. Okay, it's 5. The cooling system design, the terminal types of fiber, the quality and the quantity of the light, brilliance or fluence, the wavelength, the types of the wavelength, and the types of the sources. This is not only technical choice, but this is in second time you see the effect in the protocols. You chose the don't good cooling system, don't have a good gold in the protocol. The diode, a semiconductor PN junct, correct the causal electron migrate for the nail region to P region. Okay, this process generation the packet of energy called photon. And this photon proves between 2 myrons. The distance to myrons definition the number of the types of the wave. The distance 810 nanometers, this diode have 810 nanometers photon. This is example. The migration of the electron produce a photon. The photon brought to the mirror, and they have only one wavelength. One diode produce only Y. If you have two wavelengths, to have two diodes. For example, this laser inside have two diodes. One for 810 nanometer and one for 635 nanometer. So much important the types of the cooling, because if you don't have a good cooling system, the diode emitting the power don't constant. Okay. In any case, the possible don't result the goal. For example, for desensibilization, if you don't have a constant power, the tube, when you close them for shock, thermal shock reopen, you check the pattern of pine, okay? Because don't have a stability of power, because don't have a stability of cooling. So much important cooling for the biostimulation. The second element for choosing the end piece. The fiber is go end piece. Don't have it interrupted. For example, this is not good because of interruption and the power is low. Because I have lose the power in connection to the end piece and tips. Okay. In this case, don't have interrupter because this is only widget, and the fiber is only one. The power surgent and the power go to the cells. If you have a good system of transmission, the light, you have a good system of the fluence. The fluence is the so much number of the photon that touch the cells. If you have many number of the photon, use the low power. If you have a little number of the photon, use the high power. High power is hotting. The hotting is no predictability of the Halley. The fourth element, the choice of the types of the waveline. If you use the waveline that have affinity with the water, the cellulose is composed of the water. For example, Na80 nanometer, the China produce. This is number only for China produce. Okay, you will cutting the cells, you make the necrosis of the cells. If you use the good light, 810 nanometers, you don't produce the necrosis, but apoptosis cellular, implosion the cellular, non-explosion the cellular. This is, I don't interest the mark, but this is not good because the source Na80 nanometer is a China produced. It's not good for Professor Scarpelli. You see the deadline for the good laser down 830 nanometer. Okay, up the interaction for the water. Down don't have interaction for the water. The wheel laser, the hour laser have 810 nanometer for source. Another example about in 1980, the doctor in Italy, pioneer for the use of the laser, 80 nanometer stress, thermal stress, okay, not good for the use in biostimulation. And another questions, the source, the produce the energy, the two diodes, one for infrared and one for red. Don't like this system, another China system, because the red is LED, non-diode, okay? It's different for biostimulation because LED don't generation biostimulation, only light. In this case, say 635 nanometer generation the energy, and this is good for stimulation of proline and fibroblast. Okay, the protocols. So much important that protocols it's configured and repeatable the procedure for everybody, don't only one. Okay. Derived from the science and the international scientific publication review. The protocols have these types of the basic. The Cochrane, Medline, PubMed, the paper review. The element for the construction of the protocol is 4. The time, what the time is stopping in this point in the cell. The power, so much energy in the time. Focalizing. Focalizing, it has two significant. One, the different focalizing, because this focalizing the light, this open the light, okay? This focalize stopped and defocalize when I move it, okay? This is concept focalize and defocalize. It's the same, the fiber activation or no activation. The difference is the often in the head of the fiber. When activate the fiber, you use it for surgery, ablation, and desensibilization. We disactivate fiber usually for endodontics, periodontics, and biostimulation. This is an example for activation of the fiber. You touch the chromophore that fits in the head of the fiber, and every photon go to the color, okay? When you want disactivation of the fiber, you use these particular types of the instruments. Don't touch the skin, but cutting the fiber, because it's studios for the cutting the glasses, the fiber. 2 millimeters, okay? And the open, the focalization, don't have only out in the head of the fiber, but use the photon divergences. Periodontics. I have used these types of publication for write the book and the protocols. Let's fast. The first measure the dimension of the pocket. This is step by step for the station. I have 2 glasses, one for the water C vitamin and one for povidone iode. Okay, use inside intramucosal for gum tooth. Okay, I use don't come si dice punta? Don't worth. Okay. This is use first the water and vitamin C, and second povidone iode. Not in reverse, because this is so much sensible the vitamin C. Okay. Attention for the patient, it's possible have allergic or acido acetylsalicylic. Use this is for a patient is allergic. This is for patient not allergic. In second time, use the iodine povidone and go to for 30 seconds nasal and distal decontamination inside the pocket. You go inside the pocket, touch the bottom, release 1 millimeter for down mechanical damage, and the movement. This is movement for 30 seconds. Okay? It's possible the fiber contact with the blade activated automatically. You cutting, because I don't use the fiber activator when I use for decontamination inside the pocket. Okay? And cleaning, about 10 seconds, cleaning the head of the fiber, if possible. And second time, when I finish inside the pocket, cleaning and biostimulation external. Okay, for dimension of the pocket, biostimulation about 1 minute for regeneration to the tissue. Periodontics don't only decontamination, but decontamination and regeneration. For example, use vitamin C.
Injecting or washing?
Lava
Yes.
per lavaggio o anche solo per lavaggio?
No, è un lavaggio, però rimane un po' di...
Ok, se spală, dar rămâne, nu se clătește după. Nu si șapua.
non si sciacqua e non si aspira.
Și nu se aspiră, deci rămâne acolo, nu se reclătește și nu se aspiră.
Inside to the pocket, clean into the pocket, the fiber.
Înțelege toată lumea engleză sau aveți nevoie de...
A biostimulation after the decontamination. Okay. About 2 minutes for the pocket. If you have a many pocket, modification to the time. When I can consider the contamination successful, when the three classic symptoms of the periodontal infection disappear, the pain when chewing, bleeding and inflammation. In this case, I think it's okay, the contamination. I don't want to put inside the fiber because it's possible broken the longe attack epithelium, okay? And the second, the third and the fourth and the fifth session only by stimulation, okay? The first, second, third inside. The third, fourth, and fifth only by stimulation, okay? The distance for the treatment about 1 week. The 5 treatment on 1 week. Okay, if you have a problem 7 millimeter about the technical difference, the first technical is a sky closer. This is a technical open closer, open sky. Okay. This is an example for receptive. When you use the types of when interested the bone, okay, the problem interested don't the mucosa, only mucosa, but the bone. Why I use the laser 810 nanometer if don't have interaction for the mineral? Because I have interaction for the organic component, the bone. Bone have 2 composites, mineral and organics. In this moment I interested the organic, osteoblast, osteocyte, osteoclast. The osteoblast develop in osteocyte when the osteoclast is low. The osteoclast is the macrophage. I reduce the antigen that stimulation the produce of macrophage, and the osteoclast low, the osteoblast development osteocyte in low time. This is example, starting the classic technical, don't use laser in this moment, open for first nature surgical, okay, the contamination with the drill, and they use the laser. Don't touch, don't contact, don't activate the fiber disactivate, and by stimulation and the contamination, reduce the antigens. And second time, after the suture, I buy stimulation for have a possibility of cicatrization. Peri-implanted is the same, the concept, okay? Publication. I have the fortune of the collaboration with the Professor Daniele, the scientist in University of Verona. This is the slide, is a gift for me, the professor of the scientist. If you want to divide in 2 types of the treatments of the peri-implanted, when the peri-implanted is reversible, okay, mucosid, only mucosid, when don't reversible, osteoid, because I have a problem for, okay. In the first case, I action same the treatment of the pocket. I possible contact to the titanium because these types of the laser don't have interaction with titanium. You use the mechanical system for the treatment, and second time you use vitamin C and acid iode, and after use the laser, okay, and the biostimulation. It's the same, the treatment or the natural route, ok? Questo non parte di, vabbè. In case you have a problem of the board, we open sky, okay? Use toluidine blue if for choice, but you possible use iode povidone, okay? And after biostimulation with a laser, reduce the antigen stimulation of the bone and the contamination of the titanium. Don't have a problem for titanium. Surgical, the first periodontics is the first family of the protocols. Okay. This is a second family of the protocol. Surgery. Paper. Because I use the laser, I don't use the scalpel. Because the scalpel, bleeding, and broken so much number of the cells. Because I use the laser, I don't use the electrical scalpel. Because electrical scalpel possible fasciculary in the muscle, okay, and make the necrosis for the tissue. The laser no make the necrosis for the tissue. The first protocols, hemostasis. If you use about 1.5 or 2 watts, depending on the diameter of the vessel, the time to require to be time need stop the bleeding. We use in this case active fever. The protocol for surgical have active fever because don't only the laser but the temperature is much important in the head of the fiber. Frenulectomy. If you use the laser, is removed with 2 parallel vertical incision, extending for rectal incision papilla because it's so much important for definition of the orthodontics. Don't have fibrotic tissue here, retroincisive zone. Okay, this is condition to finish the use. No strict, no bleeding, no scarring by second intention. Much important in the pedodontics because don't stick it so much important for the syndrome. If necessary, okay, the interproximal air evaporation of the tissue. About 3 days, about 5 days, this is a fibrina for cicatrization, predicibly. For example, 2 incision and after open the diastema. No bleeding. Cicatrization about 6-7 days. They open and the finish use the gel for hyaluronic acid for reduce the residue. Possibly recommended to use the gel in the house use. Okay. Lingual frenulectomy is the same the approach but the different the anatomic condition. Okay. 2 incision for the open, and in this case use the lidocaine gel because the patient the condition is good, and open the frenulum. If you touch the sublingual, okay, you stand by in this position and stop the bleeding because so much hot when I focalize. Okay. When I stopped in this position, the block stopped the bleeding. And I use the gel. I repropose. Okay. When you make it 2 incision, if you have the frustals, the cleaning the point of the head, because the line is over. Okay. Intraoral peduncular fibroma. Position yourself 45 degrees, the angle, the clinical cleavage, and go with the laser in the attack the fibroma. This is condition excision for the fibroma. And the position of the muscular of buccinator is not good. The stick in this position with the laser don't have the bleeding, don't have the stick. This is condition about 30 days, but 7-8 days is cicatrization is completed. And the biostimulation, okay, you see the patient about 1 week after, and the biostimulation in the zone. A pull is the same, the approach clinical but not anatomic. If you want histological exam, it's possible to take the pull cut and put inside the formaldehyde for control check histological. This is condition after 8 days, this is condition at 60 days. It's okay. A similar types of condition with the papilloma, same to the fibroma, but so much important in this case, I have a capacity of sensory. In this case, use the low power for preserve the cells of the sensory in the cicatrization phases. And after the surgical, I use the active fiber for biostimulation. I active fiber cut the papilloma, and second time disactive fiber biostimulation the zone for the good cicatrization, because I want to preserve the sensory capacity of the organ. When you preserve the tissue, use the low power. Okay. Preparation of the 11 and 12 zone. In this case, I don't use a retractor cord, but I position the laser perpendicular to cleft and parallel to stem. Okay, I go to the round, and no risk of the gingival recession with these types of the technique. And by stimulation, and use the framework as a stop of the wall. This is an example. This is bleeding, this is inflammatory. I see the patient go out for 7 days of chlorhexidine, but I have a laser, don't worry, I resolve in this moment the problem. I activate the fiber about 1 watt and row to the abutment, okay, and ready for the use the new framework. Gingivo ipertrophic causa the nifedipine, beta blockade. Okay, this is starting. This here arrive the goal. This case to a brush activate the fiber, and the brush only the tissue. In this moment, we use the air, okay, for cooling, and the brush cleaning the fiber about 20 minutes and stop at the treatment. For example, Every videos I make when I the tutor. This is operator don't expert. The first case. They use the laser as a for every people that in dentistry. Operculectomy, the same for the toes after between fat. The laser don't have interaction with the titanium. Okay. I go to the operculi. They open the gun for Warridge Batman. Canine includes the procedure is similar to the previous one, the operculum. In this case, to the laser is very conservative. Those don't not damage the both, and we were able to place a bracket in the same session because there was no bleeding. Let's now look at the practical case. This is the starting condition, okay, assembly, and the localization, the position of the canine. And this is operation in this no stick of the needle. Okay, the clinical condition after 3 days, after biostimulation, so much important biostimulation for reduce the times of the healing. This is an example. Use a lidocaine gel, active fiber about 1.5 watt, okay. 2 or 3 minutes for open the operculi. Don't stick, don't bleed, don't inflammatory, don't bind after the treatment. Open the operculi. Use the collage, position the bracket, position the traction in the only one session. About 5 minutes. Okay. Precancerous. I discussed this topic in the recent snowy conference about 2 hours. In this case, only a few slides. Okay. The time is compressed. The possible use 3 types of the approach for the precancerous. In 80% I use these types of the approach. The 8% this and 1% this. Okay. 85% I use this type for the leukoplakia. Take the lamb and cut off. Take the flap. Okay. I make the histological exam in the tissue. I have a cutting. Okay. And the second time I disactivate the fiber and by stimulation. This is condition about 8 days finished the intervention. Okay. This is solution number 2. For example, lichen don't fibrotic tissue. Okay. Leukoplakia have fibrotic tissue. Lichen in so much case don't have soft tissue. I power about I use the power about 1.5 watt. Activate the fiber and the brushing in the zone. Okay. And the biostimulation. This is a condition after the 12 day, 20 day for control. And the biostimulation, every you make the control for the patent, you make the biostimulation. This is an example. The soft touch, the soft control for the use the laser, the control the approfondiments, five or six straight cells straight, so much conservative. And when I finish, I biostimulation. I use the gel, if you want to use the gel, for hyaluronic acid in the studio and onward. You have a control, you have the zone you intervene. Okay, solution number 3. This is 1% in the case of the treatment dysplasia. Use the laser 810 nanometer L635 nanometer with the 5-ALA acid, aminolevulinic acid. Okay. Because I use the aminolevulinic acid, because my patient have a problem of the hemolysis or hemiphilia, or poor immunocapacity, or use anticoagulants, the particular types of the patient, I possibly use these types of acid. The possible in the market you look off another solution, 5-ALA and ethyl with alcohol aminolevulinic acid. Okay, another types. The ALA development protoporphyrin novel. Protoporphyrin name is so much important, this transmission, the development. The during about 2 hours, okay, for exposition of the oxygen. Protoporphyrin novel, it's an organic like molecular, same to hemoglobin, have inside the iron contained the oxygen. When you use the laser, release the oxygen singlet, degrade the molecular as dangerous molecular, because in the tumor precancerous cells this process allowing the accumulation of the protoporphyrin name, this defective the fusion of the protoporphyrin name in the precancerous cells allow as to explosion in the molecules interaction with the photodynamic therapy. When I use the laser, they apoptose the cells, but they use only 2 wavelengths, 630 nanometer and 810 nanometer. And only together in the diode, no in the lab, because the 635 nanometer have the power about 0.1 watt, okay, 100 milliwatt, 101 watt. Another solution, they use the laser in the ROC technique. In Italy, ricostruzione ossea combinata, ROC, acronym, in English, combined bone recondition. This is Luca Lancieri of University of Genoa, the creator of these types of the technician. You use the piezo surgery for the contamination of the bone, and second time use the wet side. You see wet side T-cell colifibrin e calcio trifosfato beta, types beta, okay, together is composed in the wet side and the compromise in the problem of the bone. And the second time use the laser for decontamination and biostimulation activation the colifibrin. The colifibrin is the incubator for reproduction of the mesenchymal cells, the transformation the osteoblast in osteocyte, osteocyte good for the bone. Endodontics, another family. Okay, paper Okay, this is an example for the desensibilization. You remember at the starting. In this case, so much important, the stability of the power. First, I make the VAS visual analogy scale. I see a patent, how many dollar, how many pine, okay, in the collet, okay. The second time I use the peroxide for the change the pH, okay, and the tubular is open. In this case, I use the small brush to the spread the thin layer of the fluoride of gel. In this case, I think the Colgate Durafat have the big quantity of the chloride, but is good, important over the 3% or 4%, no down these types of percentual. Okay. First, I have used the peroxide, open the tube, put on the fluoride, and second time I activate the fiber but use the low power because I want evaporate the water inside the gel, the water, the fluoride go in the tube and the water evaporation broken the gel, broken the molecule of the gel, okay? And second time you biostimulation the zoom and the closing the tube. Very important, for 10 minutes after the procedure, the patient saw no rise, no drink, no spit, but remain still. This is to assume that the tubular are closer as the cold reponent during the thermal shock. I don't want thermal shock, but if you use the air in the zone, the tubular is open, okay? This is a condition, the start, a condition, the finish. When you check the patient, about after 10 minutes, the patient have the sensory of the pain, little pain, the possible repeat the treatment in the only one session, 2 treatment in only one session. It's no procedure doesn't no work in the on calcificate or atrophic dentin. I need the dentin mobile, don't atrophic. Okay. I repeat the seconds. Use the gel after the oxygenated water. Activate the fiber because I want little hot. Use a low power, 0.3 watt. Okay, a little circular in the zone. Evaporation the water the gel. Stand by for 10 minutes and check the result with the patient. Directing pulpal capping. In this case, I cannot be done because the tooth is rotten, is black, is no good. Pulpectomy is necessary. Okay. Pulpectomy, the surgical pulpectomy. Okay. In this case, I make the pulpectomy, don't pulpectomy, but pulpectomy. In this case, I activate the fiber about 0.8 watt and brush in the zoom of the pulp, they change the color and they change the consistency. Okay, it's stronger when I touch, is good for recheck pulp capping. If don't know change the color, if don't know strong the touch, is no good. I make the pulpectomy. Okay. In this case, I pulpectomy because produce the collagen stratification is good for handling the pulp. Canal root treatment. Okay, This is starting, use a mechanical treatment, and the end, when you use the peroxide, you use the laser with a cross jet, okay? A liquid movement. Don't touch the bottom to the canal, about 1 millimeter. Enter in the canal with the laser off, for don't touch the bottom. Reach the apex without about 1 millimeter. Deactivate the fiber. In this case, fiber disactivate, okay? And the movement to apical, coronal apical, about 10 or 20 seconds with the humid canal, with the hypochlorite inside the canal for the first treatment. The second and the third, dry the canal. Okay? The times depend on the dimension of the canal and the condition, clinical condition. This is example, retreatment, the second session. Mechanical treatment, hypochlorito, and the laser. Dimension of the fiber, and regulation the dimension of the fiber, disactivate the fiber, and put inside the canal. This is the movement. Circular movement, okay? Apical, coronal, apical. And close in the one session. I possibly use the laser when I make the apicectomy. You use the laser for the hotting the gutta perca. Don't use the plaque, for example. And for decontamination and biostimulation, the cavity. Abscess, the same the treatment, okay, the fiber 400 millimeters, and use 1.5 watt. In this case, the fiber is activated because I decontamination the zone, but surgical evaporation the zone where the abscess, the position abscess. After, we must first address the primary causes. Odontogenic fistula. You use the fiber, the 200 or the micromillimeter. In the laser, I have the two fiber, 400 micromillimeter and 200 micromillimeter. 200 micromillimeter used for endodontics in the canal and in the fistula. For every treatment, use the 400 millimeter. Go inside the fistula, put the pedal, and go soft the treatment of the contamination, the fistula. You see the pattern about after 1 week, and biostimulation in the zone. At the possible, see the pattern at the second week, and the biostimulation in the zone.
Fa caldo? E prea caldo da aer?
Per adesso nessuno ancora ha preso il sonno. Per me è già un obiettivo che ho raggiunto, arrivare a un'ora giusta senza nessuno addormentato. Biostimulation. This is the third protocol that use the hygienist. In Italy, the hygienists have a law for use the laser, possible for biostimulation, desensibilization, the pocket, the bleaching, okay, 4 protocol. The laser are a certificate for dentistry and hygienist. If possible, I have 2 passwords, different passwords. Okay. Biostimulation. When you use the biostimulation, every movement, don't focalization in only one position. The protocol, the biostimulation, follow another protocol. For example, I use the protocol for the surgical, follow biostimulation. I use the protocol for the pocket, I make biostimulation. Biostimulation, the second protocol. The first and other types, biostimulation following. This is an example of the treatment of post-extract soccer. Okay, in this case, I have every 5 regeneration of the tissue, hemostasis, decontamination, antiphlogistic or anti-inflammatory, analgesia post-injection, the field anesthesia, and biostimulation. This is a result of research of the Sapienza University of Rome. They check about 50 patients, 25 with biostimulation for extraction, and 25 no biostimulation. We see the different and write the article for these types of the protocols. Another case of the biostimulation or the chemi-induced mucosit. In case of contact of during introduced mucosit, such as chemotherapy, induce the mucosit. The biostimulation session can be performed to promote resolution of the lesion with a few hours. In few hours, the stop of the mucosit, the sensation for the patient. About 40 hours, the mucosit is not present. Osteonecrosis, this is a particular type of the protocols because it's so much dangerous when you brush the zone with the laser. The protocols are very delicate. If you lose the tissue, you never get it back. So much important, reactivate the zone with little ablation tissue, and second time biostimulation for about 2 months. Okay, 1 week session for 2 months, about 8 or 9 treatment. Another types of the protocol, the after impedodontia. Okay, with biostimulation can be take the cancer source, the water large or small. We use 2 different protocols because the little after I only by stimulation, this is sublimation. In the big or the major in Latin, after I use cutting for evaporation. Activate the fiber and brushing the after. Make the biostimulation and see the pattern about 2 or 3 days after is no position. Herpes labial, the same, the treatment. If you have bleeding, you activate the fiber and slowly movement, use the make the scar in the zone. If you don't have the bleeding, it's possible only biostimulation about for 1 or 2 minutes, 1 watt the power. This is a condition 8 days. This is a particular types of the patient because have many age, okay, and a dangerous condition. It is in 8 days. Bleaching, the 4th protocol for hygienists. The operating principle, the 810 nanometer laser induce the hydroxyl peroxide to separate the 2 molecular oxygen atoms, the separate and the oxide the organics in the tooth. Okay, the possible use with the carbamide, and also for carbamide peroxide, the different will be the action from the products active. About the problem is the time. For oxide, about 10 minutes. Carbamide, about 20 minutes. Okay. The protocol involves radiation each tooth individually. We diffuse the laser, then for 30 seconds after applying the laser lets the hydrogen peroxide act for the duration recommended by the manufacturer. Check the times of the peroxide action. So much important you use the single treatment for one element. Don't use, for example, these types of the fork. This is not good because the laser and the light collimat, in this case the laser is separated but no equilibrated. So much important to use the color in the gel. Okay, the gel about color for the attraction, the laser. This example, starting? No. Yes. This case is red, but it's good is red or blue. For single element, 30 seconds. Possible use these types of and this is the news. This is the old piece because don't have the separator. In this case, the length is a protect of this, okay, and study the length because have a maximum power in the finish distanciator in this position, okay. This is a protect the aggressive acid, the peroxide, the length. Okay, regulates overflowing glass. You think, but if I use many biostimulation, this is a problem for the tissue. No problem because the energy, when you use the water offside the glasses in the same to the cell, when you use so much power in the cell, the possible full the cell. Okay, this is our courses for discussing the biostimulation. Okay, I stopped for the protocol for dentistry. I see another protocols for dermatology, aesthetics, art, physiotherapy. Okay. Dermatology. Possible use the laser for the worms. It's a problem for the worms and the residue. Okay. With you use the laser, don't have this problem. You use the fiber active about 1.5 watts and evaporate the worms. In second time, you biostimulation the zone for cicatrization. Chelite is the same, activate the fiber and the brush in the zone and the escara, make the escara. About 7 years for handling. You see the pattern about after 1 week, biostimulation concession. Xanthelasma, it's a particular types of the treatment, but it's inside the book. Okay, this procedure patient sold were dark proctative. The goal is converting on that ear at the area. okay, using and active the fiber for micron, 400, sorry, micron, evaporates the superficial tissue exanthelasma. This is the operating. You use povidone, diode povidone, cover the ear. They use the eye. Don't use the anesthesia in this case because you use the low power. And evaporation the flat. Melanocytic nerve, in this case, so much important histologic, okay? The same as the treatment. Activate the fiber and take and extract the tissue. Put inside the formaldehyde, check the histologic. Pedunculate fibroma, offside the both, same the treatment, extract and cutting, and second time brushing the zone with the laser, the fiber about 1 watt and half. Papules, and in this case activate the fiber and evaporation the tissue. Necrobiosis, the same. Folliculates, I have two approaches. The acne cells, the contamination of the zone, I use in this and pills and power about 2 or 3 watts, and the contamination in the zone. Okay. In the case of the cicatrization, in the second case, I little resurfacing. Okay. In this case, use these types of the NPs, active the fiber. The power is low, but I try only 1 session, and I review the patient about after 1 week for look the condition. Is it good? Okay, I go to the every Zoom the treatment. Vitiligo e psoriasi, the cause is not defined, and therefore the result is not certain. About 25% of the good result in this case. Only biostimulation, about 10 sessions for have result. Okay. For psoriasis and for vitiligo, it's the same, because in every case I don't know the causes this is problem. Keratosis, possible use the fiber active and brushing the zone, low power, about 1 watt, and second time by stimulation. I see the pattern about after one week. Lentigo use the power so much low, about 0.5 watt, half watt. Okay. Soft touch, only 1 action and stop. I see the pattern about 1 week, because if you return in the zone, it's possible the mange basal membrane. You see, you know the memory in the connective tissue. If you touch basal membrane, don't have memory. Okay, it's possible the hyperchromy development in hypochromy. The ball, the transformer in the white lentigo. Okay, so much important. Don't receive the sun ray. Okay, in the zone. Scar recondition. Use the ablative technique in the suitable for appointment post-operative of the fibrotic scar. Not depression, the laser, not apportation the tissue, but evaporation the tissue. With conservative power starting 1 watt and increasing as needed with active fiber. Okay, after biostimulation, you see the pattern about 1 week and repeat the biostimulation. This is the treatment popped on you, activate the fiber, the treatment. Soft treatment, don't strong. Use the eye. When change the color, I stop it. Okay? Sublimated tissue. And biostimulation. And they use the gel if you want. You see the pattern about 1 week, biostimulation, checking. If you want little surgery for complete the operation. Okay, aesthetic medicine. The protocols is subdivided if you use the hyaluronic acid or don't use hyaluronic acid. Possible make together types of the protocol. The protocol repair the damage causal of the exposition of the sun. Okay, when the exposition of the sun not pathological, only aesthetical event. The laser, the main benefit is technology are the fiber revitalized collagen, the lasting reconstruction, reversing the negative effect of UV rays, the cellular biostimulation. The treatment with the active ingredient involved the pre-cleaning the tissue, followed by the application of actinic laser of the serum hyaluronic acid on the area to the burn. Directly with the hand pills into the gel and a little circular, about 10 minutes in every phase, 5 sessions, 1 week distancing of treatment. When you use to mature skin, a little power 1 watt and half, where the normal skin 1 watt, while not mature skin 0.5 watt. The different the power, the time the same, the acid is the same, okay? The session, the number of the session the same, different only the power. This is, so if you see, this is hydrated. The during about 6 months, these types of the treatment. After the 6 months, 1 session for refresh.
Every 6 months?
Scusa?
Every 6 months. Ogni 6 mesi?
Ogni 6 mesi.
Devi rifare?
Dipende dal response of the patient. But see, every 6 months it interesting because of the circular, the continuous, the dependence. This is a dependence. I possible use the laser with the filler for minimize the patient discomfort during the infiltration. Afterward, reduce the swelling and the risk of localized infection. And depersonalization. With you, after the filler, use the laser, reduce the depersonalization. Arteriovenous. It's possible to use the laser for many types of occasion, for hemangioma types 1 is going for hemangioma types 2 when is flat. For telangiectasis in the face or in the leg, and the different types of the protocol. The protocol inside in the book, in the laser. Okay. The possible use for rosacea, in the case of the telangiectasis hemangioma, I use these types of the handpiece. For rosacea, I use these types of the handpiece, okay, the different protocols and the handpiece. The possible use in the spider, it's many frequently it keeps the problem. This case in the hemangioma flat, when I use the laser colliquation to the blood and reduce the pressure, and after the cicatrizate in the zone, and after biostimulation, I see the patient about after 1 week the condition. The macrophage continues the work in the 1 week, okay? And this is the case in the telangiectasis. These times so much, this protocol, you have so much patent because they launched the protocol. For these types of the treatment, every portion of the leg, about 1 hour, so much launch. This is the big launch treatment when you use the laser. The any treatment about 1 minute, 2 minutes, in this case 1 hour. Okay. But if you want the possible main result. Okay, physiotherapy. When I use the laser in physiotherapy, when I problem inflammatory, scar pressability and pain. The protocol is the same, they change the name, but the laser don't make the different, you have periarthrite or epicondylite, don't important for the laser. The protocol is different, but the operative is the same. Little different TMG because of a little space of the tissue. Okay, go to the 3 the anatomic zone and the change point, and by stimulation about 5 minutes, and I see the pattern about after 1 week for repeat. The protocols, it's for problem to the bone, the fracture, the tendinous, fascicle plantar, stupor, paresthesia, diaresthesia, and other types. Change the name, the same the protocol. You see the pattern, the first free treatment every 3 days in 2 weeks, okay? After treatment 5 or 6 treatment 1 week, or every 1 week. This is a treatment standard. Okay, for random, I take the zoom. I don't know the profundity of the laser when action. If you change the power, you random, you know the contact, the zoom, the interested. When you make one emission, 1 watt for 1 minute, after 1 stop for pause 1 minute. And repeat for 5 sessions, okay? 1 go, 1 stop, 1 go, 1 stop, 5 minutes. Repeat for every 3 days and for 1 week distance. Safety. Now, in Italy is the present the particular law for the use the laser. In Romania in this moment don't have these types of the law, but it's present a European directive for the use the laser, for naming the laser safety officer. It's possible naming laser safety officer if you make the courses, okay, and have the the demonstration of the courses, don't only this, but a copy of the syllabus must also attack the specificity, the safety was discussed, and the copy of the questions you have a response. Every three documents important. This and syllabus, a copy of the questionnaire. This is for law of the security laser officer. Okay. At this point, the questions arise spontaneous. Okay. How much does it cost? What can be the return the user laser technology? It depends on the technology, the schooling, and the training received. Okay. If you use the right technology, 810 nanometer, 810 nanometer, and 635 nanometer, okay, and have a good training, you avenge about can improve by the 20% each year. If you turn is a cent, 100 with the laser become 120. If the same the name the collaborators and the same the number of the patient. The difference is the treatment. To be efficient with the laser technology, you need the schooling, the training, and the technology together. In different cases, the wrong the laser don't take the courses, the instrument become the gadgets. Okay, it's no use. You have the laser, but you don't use because this technology is no good, and you don't know the use. The difference to investment and the cost. If you want only the cost, choose these types of the laser. If you want the investment and produce the business, choose this solution. Okay, I'm stopping to speak to the laser. I speak the electroporator, few little slide. Okay, the electroporator exhibition exposed the exhibition in Dubai about 1 month later. Okay, for the first time, these types of technology. This is the same for design to the laser, but the technology is different. The laser emitting the radiation, the light, the electroporator emitting the electrical impulse. Okay, this is only for aesthetics medicine. The technology low voltage electrical impulse temporarily increase the permeability in the cell to creating the aqueous channels called pores, the electropores. They open the cells, put inside the hyaluronic acid. Don't filler, okay? Non-invasive, deep controlled, painless, no sensation of the pain, reversible effect. Okay. The electroporation, also the transport produced past the strome, the corneum, the throat corneum, and the cell membrane, covering the active ingredient into the target tissue. The clinical application about the 2003, the Nobel for the discovery these types of technology. I have the first my courses in the 2007 in Gabriele D'Annunzio University to Pescara for use this technology. I know very good these types of technology. NB Electronics is creation these types of technology in this year, advanced the aesthetic medicine system combination the technology and specialist cosmetics This cosmetics is a study only for electroporation, for dimension, for put inside the electropoly. All active ingredients have been designed to electroporative use. A common base of hyaluronic acid allows for effective and safety transmitted passage. I have different types of the protocol for the don't mature condition, mature condition, and so much mature condition. Okay, we have the time different, the ingredients different, and the number of sessions different. This is an example for the use the and the pairs. Do the job. About 20 minutes the treatment. This is condition, the starting and arrived. Okay, the goal. The different is the reduction the glabellary, reduction the weakness around the ears, fertility of the nasolabial. Starting and go. The possible treatment with the body, if you like, use the phosphatidylcholine for disgregation, okay, the molecular to the flap. Another condition, another protocols. It's different to ionophoresis. There's no different types of technology. Ionophoresis use everybody for treatment, the current, for passage the current. Electroporation, only one seat. Okay. Different for radiofrequency. Radiofrequency, they manage the tissue of the fibroblast in the use in the ear. In this case, don't manage the tissue. Possible use in combination with the laser. After use the electroporation, and after use the laser. Okay, the laser and electroporation. This is condition before and after. For the man, don't only in the woman. Creation providers is customer with safe of art instrumentation made in Italy, cosmetic solution design specific, training for use the technology, a certificate, creation of open day when you make the courses possible, invite the patient for the open day for presentation by your patient these types of technology and informative material for advertise the service. What's the types of material? What's the approach to patient they use when you use these types of technology? All these lens as the exposure, the high-tech device for communication that welcome odonto marketing. What is from medical device at marketing? They connect the clinical technologies. So much important the communication that you have these types of machinery, the device for dentistry, aesthetic medicine. You use the 4P. The marketing, product, price, place, promotion. The products, the diode laser, the electroporator as an extension of the offer for your patient. Integrated aesthetics, dermatology, and dental treatments. The product advanced the technologies, they are a symbol of the innovation, the safety, the premium study placement. The price definition, the price consistent with the technology, the skill and the patent target, the combo packet possible make the combo packet, the dentistry and the aesthetics. This is the strategies of the price. The place where to provide the service, the dental practice is a multidisciplinary center in relation to the dermatology and aesthetic medicine of the face, the completed of the face. The promotion, the party educational and information, the social media open day, the information courses, the informative clinical content. Use the social media with the products that is included the packet, the instrument. We buy the instrument, buy the courses and the instrument for communication. Okay, the attracting the new patient, the aesthetics need, cross-selling sanitario, cross-selling sanitary, the healthcare cross-selling propose another types of the treatment over the treatment usually. This is the marketing pack. The banner, available laser treatment, the script when the new patient, come si dice sala d'attesa?
În sala de așteptare.
Sala da aspettare, use the banner and the flyer for you exhibition, the treatment. And so much important for me, the videos for the geolocalization. In Italy, starting these types of the video. This is in Italian, but for when the patient search in internet, I have the problem for the parodontology, for example. This is video with the patent in the platform, in the web site, and through your address. This is Italian, but the map every the world. The possible make the crossover the limits of the country. If you want create that the dumping sanitary, this is it good system for dumping sanitary creation. Okay. If you want for the courses in person online, just follow the social media and in the site of the laser creation. Okay, I finished the courses. The second part is the practical part. Is pauses in this moment. Okay.
Yes, of course.
Okay. Okay.
Luăm o pauză.